A lot of people over 60 feel relieved when their blood pressure finally comes down. The reading looks better, the doctor seems less concerned, and it feels like the treatment is doing exactly what it should. But there is a quieter problem that often gets missed. A blood pressure medication can help control the pressure inside your arteries, while at the same time, putting stress on kidneys that are already more fragile than they used to be. I am Dr. Warren Hung, a medical doctor, and this is one of those topics that deserves a much clearer explanation than most people get. And if you appreciate simple, medically grounded health explanations without the confusion, subscribe and stay with me. The first thing to keep in mind is that your kidneys are not just passive filters. They are living, active organs that depend on a steady blood supply every minute of the day. Their job is to remove waste, balance minerals, manage fluid, and help regulate blood pressure itself. They do all of that through millions of tiny filtering units that need the right amount of blood flow to keep working well. When that flow drops too much, even for what seems like a reasonable medical reason, kidney function can start to slip. That matters even more after 60. As we get older, the kidneys usually lose some reserve. They may still do their job well enough on a normal day, but they often have less room to handle stress. That stress can come from dehydration, illness, poor appetite, low fluid intake, heart problems, diabetes, or simply taking several medications at once. This is why two people can take the same blood pressure medicine and have very different outcomes. One does perfectly well. The other starts to feel weak, dizzy, dried out, or shows a sudden change in kidney numbers on a blood test. And this is where people get misled. They assume kidney trouble would be obvious. They expect severe pain or some dramatic sign that something is wrong. But kidneys often do not warn you that way. In many cases, the damage begins quietly. You may just feel more tired than usual. You may notice less appetite. You may feel lightheaded when you stand up. Or you may feel almost nothing at all until lab work shows the change. That is why this topic is not about scaring you away from treatment. Blood pressure medications help many people avoid strokes, heart failure, and other very serious outcomes. The real issue is not that these medicines are automatically harmful. The real issue is that after 60, the body becomes less forgiving. When the medication, the dose, the hydration level, and the rest of your health picture are not working together. So let us start with the first medication group on this list, because it is one of the most common. The first group is diuretics, often called water pills. These medicines help the body get rid of extra salt and water through the urine. That can lower blood pressure and reduce swelling. For many people, they are useful. In the right setting, they can be very effective. But in older adults, they can also push the body too far toward dehydration. And that is where kidney stress begins. Think of it this way. Your kidneys need enough circulating fluid to keep blood moving through their filters. If too much water and salt leave the body, blood volume can drop. When that happens, the kidneys may receive less blood flow. Less blood flow means less oxygen and less support for those tiny filtering units. And once that starts, kidney function can worsen faster than many people expect. This can happen even more easily in someone over 60 who already eats less, drinks less, or has days when they simply do not feel thirsty. It becomes riskier during hot weather. It becomes riskier with vomiting, diarrhea, fever, poor appetite, or long hours without enough fluid. It becomes riskier when someone assumes that because a medicine is routine, it must be harmless, no matter what else is going on in the body. I have seen this happen in very ordinary situations. Someone starts a water pill, their ankles look less swollen, their blood pressure improves, and everything seems fine. Then a stomach bug comes along. Or they spend a few warm days outside. Or they lose interest in drinking water because they do not want to keep getting up at night. Nothing feels dramatic. But inside the body, the kidneys may be getting less and less support. That is one reason older adults can get into trouble so quietly. They are not always dealing with a bad medication. They are often dealing with a medication that became risky because the conditions change. Another problem is that swelling can fool people. A person may look puffy in the legs and think they are carrying too much fluid overall, but that does not always mean the kidneys are safely perfused. Fluid balance in the body is more complicated than that. You can have visible swelling and still have kidney circulation that is unstable. So when a stronger push to remove fluid happens in that situation, the kidneys may pay the price first. This is also why the phrase, "just a water pill," can be misleading. There is nothing simple about changing fluid balance in an older body with less reserve. That is especially true if there is diabetes, heart disease, reduced appetite, or early kidney disease already in the background. Have you ever been started on a blood pressure medicine and then told later that your kidney numbers had changed a little? A lot of people hear that and do not really get an explanation. They just hear that the doctor wants to recheck labs. But the reason matters, because once kidney blood flow begins to fall, A very different kind of pressure problem can start inside the kidneys themselves. What makes this so confusing for many people is that the next two medication groups on this list are not usually described as kidney-damaging medicines in a simple, direct way. In fact, they are often prescribed because they can help protect the heart and, in some people, even protect the kidneys over time. That is true, but it is only true when the conditions around them are right. And after 60, that when matters more than most people realize. The second group is ACE inhibitors. These medicines are commonly used for high blood pressure, heart disease, heart failure, and diabetes-related kidney protection. They work by changing how certain blood vessels tighten and relax. In plain language, they reduce some of the pressure signals that make blood vessels clamp down too much. That can be very helpful for the heart and the circulation. It can also reduce strain on the tiny filters inside the kidneys. So where does the risk come in? The risk comes in when the kidneys are already depending on a certain pressure balance to keep filtration going. Your kidneys do not just need blood. They need the right pressure inside a very delicate filtering system. If that pressure falls too much, filtration can drop. That means waste products begin to build up in the blood, even if you do not feel very different right away. This is why an older adult can start an ACE inhibitor and then be told a few weeks later that the creatinine went up. That does not always mean something disastrous has happened. Sometimes a small rise is expected and manageable, but sometimes it is the first sign that the kidneys were more vulnerable than anyone realized. This becomes more concerning in people who are dehydrated, people with heart failure, people whose blood flow to the kidneys is already reduced, or people who may have narrowing in the arteries that feed the kidneys. In those situations, a medicine that normally helps can suddenly lower kidney filtration too much. And because many people over 60 already have some hidden decline in kidney reserve, the margin for error is smaller. The third group is ARBs, or angiotensin receptor blockers. These are often used for many of the same reasons as ACE inhibitors. They are also good medicines for many patients. Many people do very well on them, but the same basic caution applies. A helpful medicine is not the same thing as a harmless medicine in every context. Older kidneys have to be watched more carefully, especially when hydration is poor, when several blood pressure medicines are being used at once, or when another illness is happening in the background. That is the part many people are never really told. They hear that the medicine is kidney protective, so they assume there is no kidney risk at all. But those two ideas are not the same. A medicine can protect kidney tissue in the long term for the right patient, while also lowering kidney filtration too much in the short term if the body is under stress. Both can be true. And this is why lab work matters so much. You will often hear doctors mention creatinine, eGFR, and potassium. Those words sound technical, but the meaning is not that hard once someone explains it plainly. Creatinine is a waste product your body makes naturally. Your kidneys are supposed to clear it. If your kidney filtration drops, creatinine in the blood usually rises. So when a doctor says your creatinine went up after a medication change, they are often saying the kidneys may not be filtering as well as before. eGFR stands for Estimated Glomerular Filtration Rate. That is a calculation that gives a rough sense of how well your kidneys are filtering. In simple terms, a lower eGFR usually means weaker kidney function. Potassium is a mineral that matters for muscles, nerves, and especially the heart. Some blood pressure medicines, including ACE inhibitors and ARBs, can raise potassium. That may not sound serious at first, but if potassium rises too much, it can become dangerous. So when your doctor checks those labs after starting or adjusting one of these medicines, that is not just routine paperwork. That is one of the main ways kidney stress gets caught before it turns into a bigger problem. And this is where many older adults run into trouble. They start a medication, feel mostly normal, and assume normal means safe. But the kidneys do not always send obvious warning signals. A person may feel only a little more tired, a little weaker, or a little less interested in food. Some people feel dizzy when they stand. Some notice their blood pressure is lower than usual and assume that means everything is going well. Sometimes the only clue is in the blood test. Have you ever had a doctor tell you that your kidney numbers changed after starting or increasing a blood pressure medicine, but no one really explained what that meant? That happens to a lot of people, and it leaves them confused. They are told the medicine is helping one problem, while the labs suggest it may be stressing another. The truth is that both can happen at once, especially in an older body that is working with less reserve. This is also why it is risky to think about blood pressure treatment as a single number on a machine. Good treatment is not just about lowering the reading. It is about lowering it in a way the whole body can tolerate. The heart matters, the brain matters, and the kidneys matter just as much. So if you are over 60 and taking one of these medicines, the key question is not, is this medicine good or bad? The better question is this medicine the right fit for my kidneys, my hydration status, my other conditions, and the rest of my medication list? Because once multiple medicines start interacting, and once fluid shifts get stronger, the pressure on the kidneys can build in a very different way. This is where the problem becomes more serious, because the kidneys usually do not get into trouble from one issue alone. What often pushes them over the edge is a combination of things that seem unrelated at first. A blood pressure medicine lowers pressure. Another medicine helps with swelling. Maybe there is a pain reliever added for arthritis. Then there is one hot day, one stomach illness, one stretch of poor eating, or 1 week of lower fluid intake. Suddenly, the kidneys are trying to function in a body that has much less margin for error. That is why the fourth group on this list deserves real attention. Loop diuretics, the stronger fluid-removing medicines. These are often used in people with more significant swelling, heart failure, or fluid overload. They can be very helpful when someone is carrying too much fluid and the heart is struggling, but they are much more powerful than many people realize. They can pull fluid out of the body quickly, and in an older adult, that can create a sharp drop in the blood flow the kidneys depend on. A lot of people assume swelling means the body simply has extra water everywhere, so taking more fluid off must automatically help everything. But the body does not work that neatly. A person can have swollen legs and still have poor effective circulation to the kidneys. That sounds strange, but it happens all the time, especially in heart failure and advanced vascular disease. So when a stronger diuretic removes even more fluid, the legs may look better, while the kidneys start filtering worse. That is one reason a person can feel they are improving on the outside, while something harmful is developing on the inside. Loop diuretics can also shift important minerals such as sodium and potassium, and they may leave people weak, dizzy, crampy, or unsteady. In someone over 60, that can quickly become more than an inconvenience. Dizziness raises fall risk. Weakness reduces appetite and movement. Less eating and drinking can worsen dehydration even more. And once that spiral begins, kidney function can drop faster than most families expect. The fifth group is potassium-sparing or aldosterone-blocking blood pressure medicines. These medications can be useful, especially in certain people with resistant blood pressure, heart failure, or hormonal patterns that make fluid balance harder to control. They are not bad medicines. In the right patient, they can be an important part of treatment, but they carry a different kind of kidney-related danger, especially after 60. The main issue here is often potassium buildup. When kidney function begins to weaken, the body has a harder time clearing excess potassium. Some of these medications can raise potassium further. That can become risky because potassium does not just affect lab results. It affects muscles, nerve signals, and the rhythm of the heart. If it rises too much, the consequences can be serious. And the danger is that high potassium does not always announce itself clearly either. Some people feel muscle weakness, some feel unusual fatigue, some feel almost nothing at all until the number is caught on blood work. So again, the real problem is not just the pill itself. The real problem is using that pill in a body whose kidneys may already be struggling quietly. This is also where medication combinations begin to matter a lot. One medicine lowers blood pressure, another removes fluid, another changes kidney pressure, adding to the cumulative stress. Then, an over-the-counter anti-inflammatory pain reliever is added for back pain or knee pain. That can reduce blood flow to the kidneys even more. Now the kidneys are being squeezed from several directions at once. This kind of setup is far more common than people realize, especially in older adults managing several chronic issues at the same time. And this is one of the most important truths in this entire topic. Many cases of kidney injury do not come from a dramatic overdose or a clearly dangerous mistake. They come from a very ordinary medication routine, meeting a very ordinary stress on the body. A few loose stools, a fever, a poor appetite for 3 days, a warmer week than usual, a little less water because getting to the bathroom is annoying, a pain reliever added without much thought. That is often enough to change the picture. So what are the quiet warning signs? Sometimes it is fatigue that feels out of proportion. Sometimes it is dizziness, especially when standing up. Sometimes it is nausea, a dull loss of appetite, or a sense that the body just feels off. Some people notice less urine. Others notice new weakness, shakiness, or trouble thinking clearly. Swelling can also shift suddenly, either getting worse or, in some cases, seeming to improve, while kidney function is actually slipping in the background. The hard part is that none of those symptoms automatically scream kidney problem to most people. They sound vague. They sound like age, a minor bug, poor sleep, or stress. That is why people miss them. And some people do not notice any symptoms at all. The only sign is that the lab numbers change. That is exactly why people over 60 should never assume that feeling mostly normal means a medication routine is perfectly safe for the kidneys. None of this means you should stop your blood pressure medicine on your own. That can be dangerous too. Suddenly stopping treatment can send blood pressure back up worsen heart strain, or create other problems. The safer move is a medication review, especially if there has been illness, dehydration, or a recent dose change. Because once kidney stress starts building quietly like this, the most important step is not guessing. It is knowing what to monitor, what to ask, and how to protect the kidneys without giving up control of blood pressure altogether. So what should a person actually do with all of this information? The first step is to understand who needs to be more careful. The risk is higher in adults over 60 who already have diabetes, heart failure, or chronic kidney disease. Poor appetite, frequent dehydration, or several prescriptions taken together also increase the risk. The risk is also higher after a recent illness, especially one that causes vomiting, diarrhea, fever, or reduced fluid intake. Those are the moments when a medication routine that usually works well can suddenly become much harder on the kidneys. And this is why the safest approach is not panic. It is not throwing away your medicine. It is not deciding on your own that your blood pressure treatment is harming you. The safest approach is to understand that after 60, blood pressure control and kidney protection have to be watched together. One cannot be treated as an afterthought. A very good question to ask your doctor or pharmacist is this: how often should my kidney labs be checked on these medicines? Many people take a prescription for months or years without really knowing how closely their kidney function is being followed. That is not a small detail. It matters. Another good question is, did my creatinine or eGFR change after this medicine was started or increase? That question tells you whether the kidneys showed any sign of stress after the treatment changed. It also helps move the conversation away from vague reassurance and towards something specific. A third important question is, what is happening with my potassium? That matters especially for people taking ACE inhibitors, ARBs, or potassium-sparing medicines. Potassium problems can stay quiet until they are not quiet anymore. And another one that matters a lot is, am I taking more than one medicine that can strain the kidneys at the same time? Many older adults are. They may be on blood pressure treatment, a fluid pill, and then add an anti-inflammatory pain reliever for arthritis, without realizing the kidneys are now handling several pressures all at once. These questions do not make you difficult. They make you informed. It also helps to know what changes deserve closer attention at home. One is a noticeable drop in urine output. Another is feeling much dizzier than usual, especially when standing. Another is unexplained weakness, unusual fatigue, or mental fog that seems new. Swelling matters too, but swelling should not be judged in a simplistic way. Less swelling does not always mean the kidneys are happier. More swelling does not always mean the answer is to remove more fluid. The body is more complicated than that, which is why symptoms and lab work need to be interpreted together. This is also where temporary illness becomes so important. When someone over 60 gets sick and cannot keep fluids down, eats very little, or loses a lot of fluid through sweating or diarrhea, that is often when medication safety changes. A routine that is fine on a stable day may need review on an unstable day. That does not mean making independent decisions at home without guidance. It means understanding that these are the moments to contact a clinician and ask whether your medication plan needs short-term adjustment or closer follow-up. A lot of kidney problems could be caught earlier if more people knew that simple fact. There is also a practical mindset shift that helps. Do not think of kidney monitoring as something that happens only after obvious damage. Think of it as part of normal maintenance. Blood pressure readings matter. Lab checks matter. Hydration matters. The context around the medication matters. All of it belongs in the same picture. This is especially true for people who have already been told they have a little kidney decline or slightly reduced kidney function. Those phrases often sound minor, so people ignore them. But mild decline is exactly why medication matching becomes more important, not less important. Older kidneys can keep working for a long time with the right support. What causes trouble is silent strain that keeps building without anyone checking the pattern closely enough. So the real warning in this topic is not that blood pressure medications are secretly toxic in every case. That would be too simple, and it would be wrong. The real warning is that some of the most common blood pressure medicines can become kidney stressing after 60 when dehydration, illness, low blood flow, or risky combinations enter the picture. That is a quiet part many people miss. The medicine may be common. The dose may be routine. The blood pressure number may even look better. And still, the kidneys may be struggling behind the scenes. That is why silence is the enemy here. Not treatment, not careful blood pressure control. Silence. Lack of follow-up. Lack of explanation. Lack of lab monitoring when the body changes. So pay attention to the pattern. Ask about your creatinine, your eGFR, and your potassium. Ask whether your current medication mix still fits your kidneys at your age and with your other conditions. Ask what to do when illness, dehydration, or poor intake changes the situation. Those conversations can prevent a quiet decline from turning into something much harder to reverse. And if this gave you a clearer way to think about your medications, subscribe for more medically grounded explanations like this. You can also share your experience in the comments. A lot of people over 60 have been told their kidney numbers changed, but very few were ever told the full reason.